Have you ever known someone who fell, got back up saying, "I'm fine," only to end up in the hospital a few days later? Or maybe it even happened to you. That scary moment when the world tilts, your balance slips, and before you know it, you're on the floor. It's terrifying, right? Because for seniors, a fall isn't just a stumble. It can be a turning point. But here's what most people don't know. What you do in the first few minutes after a fall can determine how well you recover and whether your body heals stronger or gets weaker over time when a person falls. It's not just their body that's affected. It's their entire sense of safety and control. In those first few seconds after hitting the ground, the body floods with adrenaline, the heart races, and fear takes over. That moment is critical, and Japan's oldest doctor, Dr. Shigeaki Hinohara, believed that what you do in those first few minutes can determine whether your body heals or suffers further harm. Most people's instinct is to immediately try to get up, brush it off, and pretend everything's fine. But that's one of the biggest mistakes a senior can make. When you rush to move after a fall, your body hasn't yet processed the shock, and your muscles, bones, or joints could be injured without you realizing it. Dr. Hinohara often said, a fall doesn't begin when you hit the ground. It begins when you forget to breathe. The first thing to do is to pause completely and control your breathing. Breathing is the fastest way to calm the body's alarm system. When fear takes over, breathing becomes shallow and rapid, which sends a signal to the brain that you're still in danger. That keeps your body tense and stiff, making it harder to assess injuries properly. By slowing your breath, you do the opposite. You tell your nervous system that you're safe, and your body begins to relax. Dr. Hinohara would instruct his elderly patients to close their eyes. Take a deep breath in through the nose for 4 counts. Hold it for a moment and slowly exhale through the mouth. Doing this a few times resets your heart rate, steadies your thoughts, and allows the shock to settle. When your mind is calm, your judgment becomes clearer, and you can decide your next steps more safely. This may sound simple, but it's deeply powerful. Many seniors who fall experience what's known as a post-fall panic, a wave of fear that can make them move abruptly, worsening injuries like fractures or muscle strains. Some even faint due to the sudden rush of adrenaline. By taking control of your breath first, you prevent that chain reaction. It's like putting your body into safe mode. Once the panic subsides, you can begin to observe your surroundings and your body's condition with focus instead of fear. Dr. Hinohara compared this moment to meditation. He believed that the body has natural healing intelligence, but it only works when the mind is still. He used to say, when the breath is steady, the body finds its way back to balance. Seniors who practice deep breathing regularly before a fall were shown to recover faster, have lower blood pressure afterward, and make better decisions about movement. It also helps reduce the embarrassment many people feel after falling. Instead of panicking or rushing to stand, taking that pause gives a sense of dignity and control. So in those fragile moments right after a fall, the priority isn't to stand up, it's to slow down. One calm breath at a time reconnects you to your body and helps prevent rash movements that might cause greater harm. Dr. Hinohara believed that stillness and breath are the first medicines the body needs after any shock, and that simple awareness can make the difference between recovery and regret. After calming your breath and allowing your body to settle, the next crucial step is to connect with what your body is trying to tell you. Dr. Hinohara often reminded his patients that the body has its own language. It whispers long before it screams. That means before pain becomes unbearable or visible, the body sends out smaller, subtler warnings. After a fall, it's easy to focus only on the shock or embarrassment, but ignoring those signals can turn a small problem into a serious injury. That's why he encouraged performing a slow and mindful body scan immediately after any fall. This is not about rushing to see if you can stand up, but rather about listening carefully to every part of yourself, starting from your head and moving down to your toes. Begin by taking a deep breath and mentally dividing your body into sections. Ask yourself simple questions. Do I feel pain anywhere? Is there tightness, numbness, or tingling? Does anything feel off balance or weak? If your head hit the floor, or you even slightly bumped it, pay attention to dizziness, blurred vision, or nausea. These could be signs of a mild concussion. Move your neck gently side to side, but stop instantly if you feel sharp pain. Check your shoulders, arms, and wrists next, because when people fall, they often instinctively reach out to catch themselves, and that's how sprains or fractures happen. Try small movements rather than big ones. Wiggle your fingers and notice if they all move freely. As you continue downward, focus on your ribs and abdomen. Take another slow breath. Does it hurt to inhale deeply? That might suggest a bruise or even a hidden rib injury. Move your attention to your hips, one of the most common areas of injury in seniors. Try to shift your hips slightly without lifting your body. If there's sharp pain, stop immediately. Hip fractures often don't show extreme pain at first, but worsen quickly with movement. Next, scan your legs. Bend your knees slightly if possible and flex your feet, feeling for stiffness, weakness, or shooting pain. End the scan by checking your ankles and toes. If one leg feels numb or won't support weight, that's a clear sign to stay down and call for help. Dr. Hinohara always said that seniors often mistake adrenaline for strength. After a fall, adrenaline can mask real injuries for hours. A person might believe they're fine, stand up and continue their day, only to wake up later unable to walk or lift their arm. That's why patience is so important during this self-check. He compared it to examining a piece of fine art after a storm. You don't rush through it. You observe carefully to find any cracks or weak points. The key is gentleness, not bravery. This body scan is not about proving that you're okay. It's about ensuring you truly are. Listening to your body with calm attention gives you knowledge and control. It lets you decide wisely whether it's safe to move or whether you need assistance. It turns a moment of fear into a moment of awareness. By treating your body with this respect, you not only protect yourself physically, but also build trust in your ability to respond wisely, just as Dr. Hinohara taught his patients to do after every fall. Once you've taken a moment to breathe and carefully scan your body for pain or injury, the next challenge is figuring out how to get up safely without causing more harm. This is the stage where many seniors make their most dangerous mistake: trying to stand too quickly or grabbing the nearest object for support, which can easily lead to another fall. Dr. Hinohara, who spent decades studying how the body recovers from accidents, created what he called the triangle of support method to help his elderly patients rise slowly, steadily, and safely after a fall. He believed that getting up should be treated like a slow dance with the ground, calm, deliberate, and supported by balance, not force. He used to tell his patients that the floor is not your enemy, but your temporary support. The first thing to do is to roll gently onto your side. This reduces strain on the spine and gives your muscles a chance to engage gradually. Once you're on your side, bend one knee and use your arms to push yourself into a comfortable, semi-upright position. Take your time. If you feel dizzy or unstable, pause and breathe until the sensation passes. From this position, move into what Dr. Hinohara called the kneeling stage. One knee and both hands on the ground, forming a triangle shape that gives your body 3 solid points of contact. This triangle of support makes you stable, even if your balance isn't perfect, and prevents sudden shifts that could cause another fall. From this position, look around for a sturdy object, something solid that won't move when you press against it, like a heavy chair, table, or wall. Avoid using small furniture, loose rugs, or anything on wheels. Crawl slowly toward that support, keeping your weight evenly distributed on your hands and knees. Once close enough, place both hands on the stable surface, lift one leg forward so your foot is flat on the floor, and keep the other knee grounded. You should now feel a firm base under you. Slowly, using the strength of your legs, not your arms, push yourself up. Move at your own pace and don't rush even if you feel embarrassed or anxious to stand up. Once you're upright, stay still for a few seconds to make sure you're balanced before taking a step. Dr. Hinohara often reminded his patients that pride has caused more injuries than falls themselves. Many seniors feel the need to get up immediately to prove they're okay, but that's when another fall happens. He would say, asking for help after a fall is not a weakness, it's a sign of wisdom. If you feel any sharp pain, dizziness, or if you can't stand up without straining, it's safer to call for help rather than risk further damage. Use a phone, a medical alert device, or even a loud voice to get someone's attention. Accepting help ensures that you recover safely and prevents small injuries from becoming life-altering. The triangle of support method is not just about movement. It's about patience and self-respect. It's a way to tell your body that you care about its limits and strength. Every small, careful action you take after a fall protects your bones, your muscles, and your future independence. Dr. Hinohara's technique became famous in Japan for helping thousands of seniors regain confidence after falls, proving that safety and dignity can go hand in hand when you move with mindfulness instead of haste. After a fall, it's easy to believe that if the pain isn't severe or there are no visible injuries, everything must be fine. Many seniors convince themselves that it was just a small accident and go about their day unaware that hidden damage may be developing beneath the surface. Dr. Hinohara, Japan's oldest practicing doctor, repeatedly warned that this is one of the most dangerous mistakes older adults make. He used to say, "A pain is a poor messenger in old age," meaning the absence of pain doesn't always mean the absence of injury. As the body ages, nerves lose some of their sensitivity, and the way the brain perceives pain changes. This can make serious injuries, such as small fractures or internal bleeding, feel like nothing more than mild discomfort at first. That's why he always insisted that every fall, no matter how minor it seems, should be followed by a proper medical evaluation. When you get checked soon after a fall, doctors can identify problems early before they worsen. For example, what feels like a simple bruise on the hip could actually be a hairline fracture. A small bump to the head could turn into a concussion or even internal bleeding if ignored. Dr. Hinohara's long-term study showed that seniors who saw a medical professional within 24 hours of a fall had significantly better recovery outcomes than those who waited. Standing tall, rolling the shoulders back, and keeping the gaze forward helps the body regain alignment and confidence. These exercises, done daily, were more than physical therapy. They were psychological healing in motion. Each successful moment of balance sends a message to the brain. You are capable, you are steady, you can trust your body again. Beyond physical exercises, Dr. Hinohara encouraged his patients to resume normal life as soon as possible, to walk outdoors, garden, or do household chores, but with mindfulness. He said that staying active is the antidote to fear. He also recommended social interaction after a fall, believing that laughter and connection reduce tension and help the body feel safe again. According to his observations, those who isolated themselves after falling tended to lose confidence faster than those who remained engaged in daily activities. For Dr. Hinohara, confidence was the foundation of recovery. He often reminded his patients that independence in old age is not about avoiding risk, but about learning how to move safely through it. By practicing balance, staying active, and rebuilding trust in their own movement, seniors could not only recover from a fall, but emerge stronger, more stable, and free from the fear that once held them back.